that description of being clinically obese. So I'd like to begin this topic once again, hopefully without an internet connection. Can anybody kind of tell me how we're coming through here without me having to go on my phone to check it out? Because I did line up an audio clip of a heart specialist, and when you hear what he has to say, you might be surprised, and how, unfortunately, in his career, when he has to operate on somebody as young as their 30s that should not have heart disease, that they did pass away after a 10-hour operation. She could be enjoying her life with her children today if she only stuck to a proper diet. And she was obviously clinically obese when she came in, and just something that could have been preventative. So without further ado, I'd like to continue that clip with this doctor and move on from there, and just a little more discussion on this.
Healthcare system are not very good at considering that maybe we're giving lousy advice.
You're not just giving advice, right? As a medical profession, you're also giving medicine. What's your perspective on medicine, and how has that evolved as you've learned more about what I guess you define as metabolic health?
Yeah, I think my view now is that medicines should be necessary a lot less often than we use them. When we look at our health, we shouldn't really have the baseline assumption that we have today that if someone's in poor health, it's because they're lacking medicine. It's because we haven't figured out the right treatment for them. Usually pharmaceutical-based treatments, maybe it's going to be a procedure or surgery. But there's almost a sort of assumption built into that, that the human body is destined to become ill, that we're destined to develop these problems, and that the only way that we are going to be able to manage and head off these problems is by advancing science, by coming up with more pharmaceuticals and more surgeries to treat the problems, instead of considering the fact that it might be something we are doing to ourselves.
There's a book in front of me that says Stay Off My Operating Table by Philip Ovadia. Why did you decide to write this book? What was your mission?
Yeah, I wrote the book because I struggled to find this information. I, as a heart surgeon, I, as a doctor, I, as someone in the medical system that is supposed to be built around making people healthy and keeping people healthy, struggled to figure out the information that's in that book.
You know, when you say healthy, what is healthy? Like, how does a doctor like you characterize health?
So I define health today as our bodies working the way they should. I talk about metabolic health in the book.
What's that?
And the way that I define metabolic health is that our bodies are properly utilizing the inputs that we are giving it. And the primary input that we give our bodies is the food that we eat. And so when we eat, one of three things is really supposed to happen to that food. Some of it gets turned immediately into energy for us to fuel all of the activities throughout our day. Some of it gets broken down so that we can build and rebuild the tissues in our bodies, processes that are always going on. And then a little of it is supposed to be stored for times when energy is not available. And what has happened in our modern environment is that system has broken down, and we end up storing too much of the energy, and we end up not being able to ever use that stored energy. And that has a whole host of downstream problems that it creates. And these are things like heart disease that I treat every day. These are things like diabetes, cancer, Alzheimer's disease, all of these chronic issues that we see becoming so common in our society today.
You're a heart doctor. What's been the most emotionally challenging day of your career as a heart doctor?
Well, it's actually the opening chapter of my book. It was the day that a very young woman ended up on my operating table, and she did not make it off my operating table. She came to me with a devastating cardiac condition. Me and my team spent over 10 hours trying to save her life, but ultimately we could not save her life. And I had to go tell her young children that their mother was not coming home to them. That was the most challenging day of my career.
Now, this heart surgeon is basically saying that a lot of these problems could be preventable. And he's saying it's not the cardiac, the walks and exercise that's going to be the ultimate thing that will define your health, although it is contributory to good heart health. But one of the most craziest things that people do is to overeat, indulge in foods that are not healthy for them. They put weight on and they can't get it off. And they go to the gym or do Zumba occasionally, and that really doesn't help them all to get the weight off. And a lot of the problems with everybody's whole metabolic health is that what the old saying that you are what you eat happens to be a reality. That 1/3 of our children are overweight. They're clinically obese, and through our nation and through the world and country, people are obese, and a lot of them are clinically obese. They're over a certain amount of weight. Their body mass index is really in whack. So a lot of YouTubers on here, of course, we're not going to mention names. We're not going in that direction, but there are many YouTubers that fit that profile where they are clinically obese, and which leads to a lot of problems with the heart. And there could be tearing of the aorta. There's all kinds of things that goes on with the vessels and arteries, and we all get arteriosclerosis as we get older. That's kind of goes with the territory. But how much we get, or if it's controlled or not, that's another thing that you actually have control of. And I'm a little bit out of whack myself at times. I'll eat a pie if it's available, or on my recent trip to Cebu, I did eat highly caloric, high calorie, high saturated fat, high cholesterol content. When you could not find any restaurants around that you would feel that would be considered to be a healthy diet. And that goes with a lot with the Philippine culture here, where basically the diet of Filipinos is vegetable oil, fried foods, high salt content, which also leads to high blood pressure. And as such, many are dying. A lot of them are kidney disease is very prevalent out here. Heart disease are two of some of the most devastating mortality issues out here. So again, the saying "you are what you eat" actually does apply. It's sad to say, whether trolls or not, I see a number of YouTubers out here that are not only obese, clinically obese, but they're going to be facing heart problems. And the whole metabolic process of your body does have to do with what you eat and what you put in it. Exercise, yes, is a consideration, certainly for heart health, but overall, to lose weight, exercise alone is never going to do it. You can walk your 20,000 steps a day and be proud about it, and you should. But that alone is not going to do anything to your metabolic health. If you develop diabetes, you're already in nowhere land, really, if you don't have it controlled. It's unfortunate that diabetes, which could be controllable, could be prevented because of somebody's diet. Although it could be genetical because sometimes people have it in their family line, but I think most of the time it does have to do with what you eat and how often you eat. Not many people fast. Fasting is a ticket to better longevity, but not, including myself, find it very hard to actually do any fasting. Now, the learned doctor that I played in here was talking about one point, a 38-year-old woman that'd be alive today playing with her children. But unfortunately, she came in the office very obese. She had all kinds of medical problems as a result of her obesity, and as a result, actually high blood pressure in her issue because she never treated her high blood pressure. So her high blood pressure caused a lot of metabolic problems and caused her early demise. The doctor worked on her for 10 hours. Unfortunately, he could not save her life, and she would be playing with her children today. But people feel that they think they're going to live forever. And if you want to just rule out other things that could happen to you, a car accident, I don't know, an airplane falls out of the sky on your head, whatever it might be. You add all these factors together that you're lucky if you're alive at all these days because of the biological events that could occur with you, viruses, bacteria, other things like that, not being very hygienic. That's kind of lower on a scale of things to be considered, but we all have atherosclerosis, which, as you may know, is the plaque and building up into your arteries, which prevents your blood flow from reaching the heart with oxygen and nutrients and everything else that your heart needs. And it's just like a pipe, drainage pipe. You have enough junk going down that drain into the pipe, and that pipe is going to build up a lot of crud around the circumference internally in that pipe, and eventually it's going to clog up, but there's no more flow of water, and that's when you're going to have a heart attack, and that's when you're going to die. But unfortunately, a lot of this, it's preventable, and although people think that they're going to live forever, and they point fingers and say, well, you're X amount of years old, you don't have that many years left in your life. When the people perhaps that are making this statement might be considerably younger than, say, myself, but yet their habits on health, whether they take supplements, whether they eat a healthy diet or not, is going to really be the driving force as to longevity as we know it, and as it will apply to your life. I see a lot of YouTubers on here. You'll see them in the bars. You'll see them on camera. It's kind of ironic that a lot of these foreigners that move into this country are clinically obese. Now, you come here to the Philippines to enjoy your retirement, but the one thing that's in your way of having a happy, healthy life and relationship out here is your obesity, and not maybe controlling your blood pressure, your development of diabetes, very critical, because diabetes can affect every metabolic function in your body. It could be like a dominoes effect, unfortunately, for those that do have diabetes on here, and I'm sure there are many that do, or are all what you call pre-diabetic, which is kind of a lame statement. Pre-diabetic means before you have diabetes. It's just basically a statement that means that you have all the elements to make you diabetic, and that you actually have to watch what you eat. Now, I'm not perfect what I eat. I talked about how I just came back from Cebu, and I had some what I would consider to be really unhealthy food in regards to saturated fat, calories, cholesterol, because it's very difficult on a whim to find any really healthy options in restaurants in the Philippines. And if you go by the average Filipino diet out here, it's horrific. Everything is fried or lots of salt. People are suffering from high blood pressure out here. It's like a plague all over the world, actually, but certainly here in the Philippines, it's almost like a plague, and it's that bad. And the food that they eat are presented on their table as children. You eat what your parents put on the table, and that's your lifestyle from there, and you learn from there. Nobody in schools are really teaching children proper diet, but even if they did teach kids proper diet, as a child, you're only going to be eating what your mom or dad could afford to put on that table. But unfortunately, for a lot of children, the food that is presented on the table is not exactly healthy food, but it does sustain their life. Rice is life here in the Philippines, but unfortunately, white rice is high in carbohydrates, which break down into starches, which break down into sugar, which breaks down into calories, which then goes into fat storage. Okay, and too much carbohydrates is not good. That includes white potatoes, pasta, and certainly rice, and which is, at least two of them are actually normal diets here in the Philippines. Unfortunately, the use of vegetable oil, which is very prevalent out here because they can't afford good oils like quality virgin oil, extra virgin oil, would be a blessing to most of these people, but not everybody can afford to buy olive oil. They're not taught in schools, as school age children are not taught health and diet in the schools. And you will see, as a visual thing walking around, you see a lot of obese women and men and children. even here in the Philippines. I always used to think prior to ever being out here that Filipinos were small and they were thin, but that doesn't really apply as much as it used to now. I mean, visually, I can see around me that people are obese. When you don't watch what you're doing, you will gain weight. I have actually gained, I have a little tummy here that I could actually grab a handful of fat. Now, that comes from both the combination of not enough exercise. And by the way, exercise, as I just discussed, is not your answer totally. It's good for cardio. It really doesn't burn off as much calories as you think it does. So you have to start with your diet and accompanied by exercise for cardiovascular health. Having high blood pressure can develop at any age. I've been fortunate so far that my blood pressure has always been normal. I've lucked out. I don't have diabetes, according to my blood tests, so I've lucked out. But does that mean I don't indulge sometimes in highly caloric, high saturated fats, sugar? I actually do. It's just that you have to become aware of what you're eating and how often you're doing that. Nobody says that you can't kind of indulge yourself on some of these life pleasures, comfort foods of that nature. You can do that, but you have to do that with control. And you have to basically stick to a more healthier diet to balance this out, along with exercise, which is important. They do go together, but the exercise alone has not been proven to be a factor in your longevity. Some people overdo their exercise, which they can get, hurt from the actual exercise. Their joints and whatnot, as they're getting older, could be affected, more wear and tear on your joints. So I think basically the conclusion of all this is that obesity is one of the biggest issues. It's like the plague actually in the world right now, especially America, and certainly here in the Philippines itself. We can see that all around us. And I've known many people out here that have died, or family members of my girlfriend, or relatives and friends and so forth, that have died well before their age because of the fact that they developed diabetes problems, kidney problems, heart disease, and so forth. Um, I can certainly see it in our family line. There are family members that are would be considered clinically obese, and it's actually something that is out of control here in the Philippines. The old saying that you are what you eat actually does apply. Now, chances are I'm going to have a piece of that apple walnut pie today. The fact that we bought it and spent money on it. I even have two hamburgers over here in the freezer that I brought back from SNR, double burger with cheese. Now, I could say throw this out or give it to the kids if they want it. I have that control, but will I control that? Well, it comes to a situation. If you didn't plan a dinner that day and didn't feel like cooking anything big, if you have something ready to eat, chances are you will eat it. Will I eat those burgers? Will I eat that burger today? I don't know. It takes self control, but a lot of us don't have that self control. And when something yummy is presented to us and it's sugary, our body is screaming out saying, "Yeah, I want that sugar. I gotta have it. Oh, I'll just control my diet another day." And do you do that all the time? No, you may not do that all the time. You're not controlling your diet. A lot of times when her relatives come to visit here, they're going to bring some Dunkin' Donuts or Krispy Kreme donuts, and it's really hard not to want to reach for them. To reach out and I'll just say, I'm going to have one of them or break one in half. And I've given into the situation a lot. So in the future, I'm going to tell anybody who visits, don't bring me donuts. And it's not actually good to give to the kids, because I do notice the kids' diet that live here and who visit here, they do gravitate toward a lot of sugary items. They're not, I try to give them my old speeches about this and that, and I try to teach them a little bit. I've gotten them to be able to accept the idea of getting to a better quality rice, like that's available out there, whether it's brown rice, which is not a big thing that most people like. It takes longer to cook, but there are different rices that are not complex carbohydrates, such as white rice, okay? And there are other alternatives that are a lot more healthier and they don't mind. And, red rice is good too. And I've tried to introduce that, and they're fine with that. But you're not going to take, rice is life here in the Philippines. You're not going to take rice off the menu of any self-respecting Filipino, whether it's part of their breakfast, it's part of their lunch, it's part of their dinner, and it might even be part of their snacks. So how do you teach a nation that you're doing wrong? Well, it starts in a school system, which they will not teach kids nutrition. And it has to do with their parents, too, as to what they eat and what they present on the table. Not all Filipinos can afford to eat quality foods. No. And they don't understand that cooking with vegetable oil and everything they eat that's fried all the time is going to be lead to their ultimate demise or really serious health problems. So, as here on YouTube, as I said, very visibly, I've seen YouTubers on here that maybe they're trolls and they're giving people a lot of shit, but unfortunately for them, their longevity is not going to be very long and they will never be a problem to you two again as a troll. It's a sad issue to address here, but I can see it all the time. Oh, I feel healthy. I feel fine. Well, they do until they have that major catastrophic heart attack because their arteries are so clogged up with plaque and calcification. And it's like I said, with the pipes, you could fill them, you could put water through pipes, but if you put crud in the drain, that crud's going to build up on the pipes. It's going to stick to, like plaque will stick to your arteries. It's going to stick to the walls of that pipe until it builds up and builds up and it no longer allows a flow for whatever you're putting down that drain, the water. And the same thing goes with your arteries and vessels and everything in your body. And the average diet, I would think, on here with YouTubers is probably pretty bad. And on top of that, if they don't smoke, they'll drink. And predominantly, most people here drink. They hang out in bars. They eat fast food. And they're not really concerned with their diet. And they think that exercise alone, they're going to get their 20,000 steps in per day, is going to solve their problem. But it's not solving their problem at all. Exercise can take off calories over a period of time, but it's not your answer. It's what you put into your body and what you eat. Otherwise, it's going to be a vicious cycle. You're going to eat to continue to eat the same crap you're eating, and you're going to do exercise to try to control the calories. But unfortunately, the exercise alone is not going to get rid of all that fat that you built up in your system. And remember, when you're eating and you're getting fat, it affects your liver. If you have any kind of a belly at all, you probably have what they call a fatty liver. And I'm sure I have a little bit of that. Anything you could grab is something of your belly is something that should be coming off. I could reach down and grab a hunk of fat from my belly right now. I probably could lose 2 inches. So with that awareness and self-awareness, you're the only one that's going to be in control of how healthy you are. You come here, for example, to the Philippines to retire. You want to have a good life, but unfortunately, you're not paying attention to your diet. You figure, I'm going to go to a local diet, be like the locals. We want to go to Rome, be like the Romans. But unfortunately, in this situation, if you're trying to be Filipino, becoming Filipino, if that's your direction, then you're going to adhere to a Filipino diet, which is not exactly a healthy diet. Now, I put these shows on like this. It's not only to inform people, but it also reinforces my thoughts, my practices, my habits, and makes me more aware of what things I'm doing wrong, because I'm certainly not perfect. So I do generally practice what I preach, but I do falter. Many times I do, but I have the awareness of making up for my faults and trying to keep. There's many times for breakfast I'll have vegetables. There's many times I'll have some beans. And a lot of times I'll have beans with rice. It might be a better rice, of course. That's not highly in carbohydrates, such as white rice. I could eat beans with flavoring and seasoning with rice, and I could be very happy with that. As long as you control everything else, you get an urge for ice cream, highly caloric, saturated fat. You eat a lot of red meat. I try not to eat too much red meat. Saturated fats are not good for you. You want to eat polyunsaturated. A lot of people eat chicken out here. Chicken's okay if you don't eat the skin. And according to how you prepare your chicken, if you're going to fry your chicken in vegetable oil, you're defeating the purpose. Chicken is actually not bad to eat. And lean meats are actually fine, actually. You could eat lean meats. There's a certain amount of cholesterol your body actually utilizes. So when they say that, you eat too much cholesterol, there's a yes and no to that. Your body actually needs cholesterol. We exaggerate a lot of our figures For example, when we do testing and we say, oh, your cholesterol level is over 200, the overall cholesterol should be under 200. That's not exact science, actually. Not really. You could be over 200, but you don't want to be terribly over 200. Okay, 240 and above and things like that, 230 is not good. That could lead to an early demise. You really want to keep it down, but don't forget your body needs cholesterol. You utilize it, actually produces cholesterol. You need that cholesterol to function. But when we go overboard on it, that's when we're causing problems. When your triglycerides, which are really important, probably one of the most important, I think, is your triglycerides. My triglycerides are pretty good. My HDLs, there's some of a low and high. They need adjustments, but they're not way off kilter. Okay, you could be perfectly healthy and be above the guidelines that they're telling you, basically, when you read up on this or hear it on the internet, and what doctors actually saying and heart specialists. You really have to have a pretty high number to be really affected in your mortality. But only you and you have control of that. So it's really sad that, people are not really adhering to some of this stuff, and they're complaining about their health conditions, but they're not doing anything about it. And I'm sure there's going to be a number of YouTubers in the next few years that probably won't be around. If you already reached around 60 years old and you have not controlled anything in your life, you developed diabetes already, and you're continuing with your diet and you're continuing eating the wrong foods and no exercise whatsoever, then you are challenging your own mortalities, what you're doing. But remember, exercise alone is just not the answer, as proven by many heart specialists. And it's really going to have to do with your diet, and that's how you treat your body, what you eat, because you actually are what you actually eat. And a lot of people don't understand the meaning of that. And you could cheat. I'm not saying you can't cheat. Even the people that are on the best diets in the world, they give in to some, highly caloric, sugary food, which as a whole is not good for you. But then if you drink on top of having a bad diet, well, then you're introducing a lot of other health factors for your heart also, and your liver, and your whole metabolic function. And what liquor actually does to your metabolics is actually disastrous. It doesn't take that much liquor. Imagine that, to do that. So imagine if you're a regular drinker. Well, you got that problem. Do you smoke on top of that? You got a problem. Is your diet really sucky? Then you got a triple jeopardy going on here. So if you're out here in the Philippines to enjoy your life, you want to get laid and everything else, a lot of people can't even perform sex because of their obesity. They may tell you that they're scoring left and right with all these Filipinos out here, but the chances are, uh, better than not, that they're not doing that at all. That they're having erectile dysfunction, they're having libido problems, and even the physicality of their whole bodily structure may be having hard to have physical sex with a woman. There's a lot of things that could affect your relationship in that respect physically with a woman. Your size, your girth, your ability to have muscle control, and drinking and all that stuff. And plus the medications that people are on too. Not everybody on here talks about all the medications they're taking. That could affect you sexually. It could overall your heart. It could affect other metabolic functions, because most medicines do have side effects. So this is all things to consider. Now, you did listen to that show, and I played a clip of this gentleman. I might play just one more piece on that, if you could bear listening to it. But this guy has something to say, and what he says is pretty vital.
Career, and that was a day that I realized things had to change. That was one of the days that set me on this pathway, that made me realize the mission that I needed to be on, to keep people off of my operating table.
Was her heart condition preventable?
Yes.
Can you give me some color into
Yeah. So she developed a condition, it's called an aortic dissection, where her blood vessel leading out from her heart tore. And that comes from high blood pressure. And she had high blood pressure that wasn't adequately addressed, wasn't adequately treated. And I believe that her condition was 100% preventable. I believe that if her physicians had understood that her high blood pressure was because of the food that she was eating, if they had given her better advice around the food that she could be eating and the impact that this was having on her life, that her path could have been changed.
She was metabolically unhealthy in your view?
She was metabolically unhealthy,
Clinically obese?
clinically obese, high blood pressure. I would say she had probably all 5 measurements of her metabolic health abnormal. And no one, although I don't know this for sure, no one likely ever had that discussion with her.
And she was young, you said?
She was very young.
But under the age of 50?
Yeah, she was 38.
Jesus.
This is one of the most troubling things that I have seen during my career as a heart surgeon. Understand that I started my career as a heart surgeon 20 years ago. And at that time, we would operate on 70 and 80-year-olds, 60-year-olds. It was rare that we would operate on 50-year-olds. Today, just 20 years later, I routinely operate on 40-year-olds, and I occasionally operate on a 30-year-old like that woman.
Have you ever operated on a 20-year-old?
Not for, not someone who wasn't there.
It's a different condition.
Different condition, a congenital heart condition. I've operated on 20-year-olds. I haven't operated on 20-year-olds with atherosclerosis, but I don't think we're far from that point. When we look at the fact that a third of the children are obese, that we see metabolic disease increasingly in teenagers and even children as young as 8 or 9 years old. There are going to be 20-year-olds ending up on my operating table in not too long a time.
I was going to ask you earlier on why all of this matters. You know, sometimes I flick around in my head and I think, well, you know, if I live to 60, 70, you know, if I live to 60, but I just have loads of fun. And when I say fun, I'm kind of mischaracterizing fun as like doing whatever I want and being driven by my own physiological and psychological like compulsions, basically, which means just, you know, junk food, whatever. Or I go, okay, I can live longer and avoid some of those compulsions that I might have as relates to diet. But I think that example you gave of why it's so important, because you had to walk out of that operating room and go and speak to a family, presumably young kids, young kids, right?
Kids. Yep.
That were how old?
The youngest one, I believe, was 3 or 4. You know, the older ones were 8, 10 years old.
I'm guessing you'll never forget that conversation. How do you prepare to have that conversation with a 10-year-old and a 3-year-old about their mother not coming back? Are you trained to do that? Is, you know,
there is no training to do that. You know, unfortunately, as a heart surgeon, you know, I have that conversation with family members, not infrequently, but having that conversation with children, with such young family members, I don't know that there's any way to prepare for that. I certainly wasn't prepared for it. One of the things that I've come to realize is no matter how good a heart surgeon I might be, no matter how good all the heart surgeons out there are, you're always better off if you never needed the surgery in the first place.
And how true that is. So there are ways of preventing you from having heart surgery. Now, unless you are genetically predisposed to have heart conditions, there's a certain amount of control that you could have over your life. And a lot of people say they reach their 60s, 70s, and they say, well, look, life is for the living. I'm going to eat all that junk food. I'm going to do whatever I continue to do, smoke and drink and everything else. And a lot of us don't have control of some of that stuff, and I'm one of them on the smoking at the moment. But it's unfortunate that a lot of us have to wait till something happens before we actually do something about it. But there are things you can do in your life that can promote good health at the same time, rather than do something that's catastrophic to your body, whether it's smoking, drinking, or drugs, street drugs, and so forth. You have some control over your overall health and body through supplementation, through diet, and things like that. Some of these things are just common sense things that all of us can actually do. Okay, so some people have the idea, and I've met foreigners that are like that, that basically say, look, when I die, I die. I'm going to continue to do what I do. I'm going to drink, smoke. I'm going to eat whatever foods I want. I don't care if they're fried. I don't care if they're high in salt and high in saturated fats and cholesterol. And a lot of people, it's amazing that I hear this, they actually conform to that kind of thought. that life is for the living, yes, but how comfortable do you want to be in your own skin is a question I would ask everybody. How comfortable do you want to be in your own skin? How metabolically healthy are you? You have a lot of ailments, inflammation from a lot of things you eat and your general health. Inflammation is what's going to kill you. Sugar will kill you. Obesity certainly is going to kill you. So it's a clear message I send out to everyone who's listening to me that we, and I include myself, we are in control of our life, what we eat, and what we do for our bodies. And if you continue along a certain path, you're not going to get positive results, and you're going to be in and out of a hospital, operations. Your heart, well, something we need. It's an organ, it's a pump. And when that starts breaking down because the atherosclerosis that affecting your arteries and vessels, veins and whatnot that are feeding blood to the heart, if they're not in really good functioning condition, if there's clogging and plaquing and everything going on in your arteries, it's just basically a recipe for disaster. Anyway, I hope you found this show to be informative. I think this does apply to a lot of YouTubers out there that I've noticed are obese. Some of them have shitty attitudes and they like to start trouble on here, but YouTubers are the least of their problems, and troll situations are the least of their problems. And being a troll, well, put it this way, there's always a beginning to something, there's an end to something, and there's an end to certain lousy YouTubers that are not going to be here forever because their lifestyle, they decided not to change it. They became obese or became diabetic, had high blood pressure. They don't control it. They continue to do the lifestyle they've been doing every day without taking advice from anyone. And it all leads to their mortality being, well, a little earlier than they would hope for. And that concludes my show.